Hello, my dear friends. It is a real blessing to be in a place which is endowed with nature's beauty. We all feel that when you are in the lap of nature, your breathing is perfect, fine, and good. Whereas when you move into a place which is totally polluted, having the cracking noise of vehicles, air endowed with a lot of pollutants, naturally you will feel your breath becoming difficult. Friends, I am talking to you about a very grievous issue faced by all of us today. Now, the population of patients who are approaching us in our daily OPDs with a difficulty in breathing, which happens to be in an episodic way. Now, you might be recognizing that I am going to talk about bronchial asthma. I am Dr. Rahul R Nair, Professor, Ashtamgam, Ayurveda, Viara Medical College. We all know that the problem of bronchial asthma is currently on rise. We all hear as well as watch the episodes in our television channels as well as YouTube that in many of our metro cities, the air pollution gradient is on rise. As the air pollution rises, as the food habits changing, as the lifestyle quality, lifestyle pattern of the patients changes, the number of bronchial asthma patients are currently on rise. And many a time the patients will come us and tell us that it strikes almost unexpectedly, and they are for a long period of years, they are under the use of inhalers, bronchodilators, etc. So they are asking us every time that is there a sustained solution available? I want to tell them that yes, through Ayurveda, we are having sustained solutions for bronchial asthma. I repeat the term sustained solution. What do you mean by a sustained solution? Even if you have to take some medicines for controlling the bronchial asthma, it never happens to be a sustained one. After every episode, you will be withdrawing the medicines, you will be living the usual life, and another episode strikes and you take another bronchodilator, etc. So, this episode is going to continue. Whereas in a sustained medication or sustained relief, what I mean that when you undergo a therapy or when you undergo a protocol, Ayurvedic protocol, and even after its withdrawal, we feel that the patients get a long-lasting relief. So, in case of bronchial asthma, a combination of internal medicines, Panchakarma procedures, as well as a very good change which is going to happen in lifestyle as well as dietary habits, all these can coupled together will give you sustained relief from this situation. So when I tell you about Ayurveda offering you sustained solutions in bronchial asthma, many of you may be in doubt and asking me that asthmatics generally have a genetic predisposition. Yes, it is true. We term that phenomenon as atopy. Atopy means the allergy or hyperresponsiveness that is handed down through generations. So there is a genetic predisposition. Some individuals are more predisposed than others to getting asthma. So then how a sustained solution can be offered? I will tell you some statistics. Almost 80% of asthmatics are found to be having atopy. That means they are having genetically transferred allergic pattern. But almost 80% of atopics are not having bronchial asthma. That means there are some triggering factors that trigger your immune system to work in particular way that you are becoming episodic bronchial asthmatics. So, I want to say that even though you are having a genetic predisposition for becoming asthmatics, it is not necessary that you will become an asthmatic. So, what all are that risk factors that make you a person with episodic breathing difficulty? So that the answer to that question is that a host of factors will work as triggers. Generally, now we feel that even after the post-COVID times, when the entire system has been slowly opening up, many times we are now getting more comfortable to be restricted to our interiors. We spend most of the time inside our offices or inside our cozy bedrooms, or inside our flats. There everywhere we will see that we are having carpets, curtains, wardrobes, etc. Everywhere we will be finding some dust mites and some particles which can trigger our immune system. So one of the important causes of getting this asthma is having more time devoted in the inside or indoors. But I may not forget the fact that outside world may be having a lot of pollutants or lot of toxins which can trigger again you to become an asthmatic. The second important factor from an Ayurvedic viewpoint is that the food habits which you follow. Some food substances, I am not going to list you and tell you the names of certain food substances. Instead, I will use another approach wherein I will tell you the quality of some food substances that may trigger asthma inside you. One of those class of food substances which Ayurveda targets is known as Abhishanti Ahara. I will repeat the term Abhishanti Ahara. Abhishanti Ahara is those food substances that may trigger bronchial asthma in you by triggering inflammation. So those food substances which are having a property to trigger inflammation inside your body is having this property of triggering bronchial asthma. So one important point I will tell you, all those food substances which are having thickness like curd, mayonnaise, cheese, etc. or those food items which are fried in oil, those food items which are having a lot of inflammatory substances inside it like pickles, etc. are having this property of triggering bronchial asthma by becoming Abhishanti. The second class of food substances are known as Vidahi Ahara. Vidahi Ahara are those food substances which may lie dormant inside your digestive tract for a long time before getting fully digested. In another way, it triggers Pitta dosha. So, when the Pitta dosha and Kapha dosha are triggered by the use of Abhishanti and Vidahi Ahara, that itself paves one important platform. It will maintain a platform for becoming an asthmatic. The study shows that all people who are having bronchial asthma, they are having chronic airway inflammation. This chronic airway inflammation will be continuing for a long time, and in between there are certain triggering factors which operate on that chronic airway inflammation and create acute exacerbations of asthma. So you should picturize yourself as a person having chronic inflammation. So all those substances which I have mentioned in my previous words wherein I talked about Abhishanti, Vidahi Ahara, all such substances should be avoided. So I will list once again the use of curd, especially at night, pickles, puppets, fried substances, those substances which are prepared in oil, the artificial food substances like mayonnaise, all those food substances which are preserved by using different chemical agents, all those should be removed from your diet. The very second important factor is the timing of your food. If you are a person who is fond of taking late night dinners, that itself can trigger the asthma inside you. So have early dinner, especially just after the sunset. That itself will help you to be in bed with an empty stomach. The third important factor is something which is related to our lifestyle. Many a time, the persons with bronchial asthma, they say that they will be having some patterns in their life which they are very much fond of. For example, trying to be less physically active, getting exposed to air conditioners, always remains in closed indoor areas, never allowing fresh air and sunlight to reach inside the home. All those patterns, if you are practicing, never do that. If you are an asthmatic person and if you are using an air conditioner, it is a very important fact that during daytime, you have to open the windows of your bedroom to get the fresh air and fresh sunlight inside and create the bedrooms with the less humidity. And also, if you are less physically active, I will advise that you have to be physically active and try to find out some aerobic exercises which can help you slowly do that aerobic exercises. One important good exercise is walking, but try to avoid very cold and humid conditions when you are walking outside. If you are walking, if you are doing the activities like walking and you feel that you will become more physically active, less will be the episodes of asthma. I'm not forgetting the fact that there is a separate class of people called exercise-induced asthmatics. For those people, exercise is contraindicated. But for all others who are having triggers, especially to dust, smoke, the change in the weather, or even to certain smells. So in all such cases, we see that reducing your tummy or reducing your weight and becoming more physical active will reduce your chance of becoming an asthmatic. So all those factors, the lifestyle factors, the sleep pattern, that is very, very important. If you are a late night sleeper and if you are very fond of awaking late in the daytime, I may say that you are having more risk of becoming asthmatic. Early to bed and early to rise should be the most important motto when you want to sleep in a very good way, so that you are having enough chance of preventing asthma. I will tell you that getting into the bed, having a mobile in your hand, looking into it will surely deprive the quality of sleep, and when the quality and depth of sleep is affected, surely the episodes of asthma will be more. So beware of that. And even if you are handling all these items in a very good way, sometimes you are a person who is wrongly handling your stress. Every one of us in all walks of life, some way or other, are affected by some sort of mental stress. Try to handle it in a very judicious way. Try to convert every distress into eustress. I will give you the term eustress, E-U-S-T-R-E-S-S. It's very important to convert distress into eustress. Eustress means a stress factor which will help you to grow. So try to convert the stress which is coming to you by using good practices like yoga or pranayama and convert it into opportunities for further growth. So this much factors which I have mentioned to you will slowly help you to get out of this recurrent episodes of asthma. Now I am going to tell you about the treatment protocols which are available in Ayurveda. In Ayurveda, we are always concerned about the gut health of the person. We have got a lot of medicines which can reduce the intensity of asthma, but that are not going to work, that are not going to give you sustained results if your gut health is not good. So first and foremost, when you approach an Ayurvedic doctor for getting treated for asthma, he will check the health status of your gut. And once if the health status is poor, we are having good medications to change the gut microflora and bring an optimum health status, an optimum absorption pattern in your gut. And once your gut is good, you are ready to receive our medicines. Secondly, our important weapon against bronchial asthma is a therapeutic procedure called Vamanam, or it is known as therapeutic emesis, wherein a person's body is prepared prior by giving appropriate amount of ghee preparations, and thereafter he or she is made to have vomiting in a controlled fashion. So vomiting or therapeutically induced vomiting can work as a very good effector against recurrent episodes of bronchial asthma. So it is very important to consult an Ayurveda doctor and to find out that if you are a right candidate for Vamanam, the Panchakarma procedure called Vamanam, essentially that you take this Vamanam once and experience the change happening in your life. Many of the biochemical studies prove that instantaneously after doing Vamanam, the level of histamine, a marker of inflammation in the blood, is getting comparatively lower. So it's a very subtle, deeply physiologically acting procedure. So our most important weapon is doing this Panchakarma procedure of Vamanam, or another Panchakarma procedure called Virejanam or therapeutic purgation. So both these procedures, if you take these procedures and follow a restricted dietary pattern as advised by an Ayurveda doctor, necessarily you will be having more than 50% reduction in the intensity of the episodes. And later, the Ayurveda doctors prefer to do immunomodulation. We know that immune system is a highly intelligent and complex system which is working in our body, which, like many of us, is having its own innate intelligence to distinguish between bacteria, virus, fungus, etc. Just like we identify the persons. And more than that, even if they can identify, they can memorize those identified patterns too. So that's why it's because of its intelligence that you will never get a chicken pox twice in your life. So such a system, it is acting in a very aberrant way in bronchial asthma. So necessarily it is very important to do immunomodulation. The body should not respond to the factors which are causing asthma. But in non-asthmatic, such factors are not triggering any response. So in your body, an asthma patient's body is harboring certain factors that may trigger the immune system to work in a wrong way and create all those responses. So necessarily, teaching the immune system to be more responsible in its response is very important. For that, we Ayurveda doctors will use certain medications that on long intake will retune the immune system so that it will respond in a very optimum manner. Such class of drugs are available with us, and we will be following into the second phase wherein we will take such immunomodulatory drugs, and the third phase we will be opting for another class of drugs called the rasayanas. You might be very well aware of certain formulations like Agastya Rasayanam or Chevanaprasham. We have got a lot of such drugs like Agastya Rasayanam and Chevanaprasham, which can be offered to patients who have necessarily completed a Panchakarma protocol as well as immunomodulatory protocol. And the third one is rejuvenatory protocol or Rasayana therapy, in which such Rasayanas are advised to be given for a long period of time. And also we are having certain ghee preparations which will be working wonderfully as Rasayana drugs in this later phase. So by correcting your dietary and lifestyle habits, secondly by undergoing a Panchakarma therapy, altering the optimum working status of the gut microflora, by doing immunomodulatory protocols, and finally by taking Rasayana therapy, it is very important that a person will be receiving sustained health benefits. I may repeat, the sustained health benefits for asthmatic patients are available in Ayurveda. So I will tell you that in Ayurveda, our ancient seers, ancient master physicians are of the opinion that the prana or the life energy should circulate uninterrupted throughout our body. But in asthma, what happens is that there is an interruption in the circulation of prana or life force. So it's our duty to control our life, undergo such therapies, and to bring back the prana into the full action potential so that you can enjoy the life in a very sustained, in a very happily, merry way. Saying that, let me re-emphasize the fact that there is essentially a very good solution rather than bearing the problem of asthma for a long time by using some one-stop solutions. Instead, use sustained solutions from Ayurveda and let the life force or prana circulate through your body uninterrupted. Thank you very much.